7 warning signs that you are pre-diabetic. Do you know that 30 million Americans are living with diabetes? That means that 1 in 10 Americans have it. Even worse, about 7 million of these Americans have not yet been diagnosed with diabetes, so they have no clue that they have it. You think you've seen the worst? Here's another one for you. According to the Centers for Disease Control and Prevention, 84 million Americans have pre-diabetes, and 90% of them have no clue that they're pre-diabetic. Let's put that in some perspective. That means 1 in 3 American people watching this video right now are pre-diabetic, and 9 in 10 of those people are completely unaware. This is extremely dangerous. The earlier you are aware of a health issue like diabetes or prediabetes, the higher your chances are of escaping fatal consequences. So in this video, we'll point out 7 warning signs that might be pointing to the fact that you are pre-diabetic. Quick disclaimer, this video will not tell you if you have prediabetes. Instead, it'll inform you about some signs of prediabetes. You still need to visit your doctor for a proper diagnosis. Before we dive into the warning signs of prediabetes, let's explain what it is. Prediabetes is a medical condition that occurs when your blood sugar is above the normal level, but not high enough to be considered diabetes. Normal blood sugar levels should be less than 120 milligrams per deciliter. Beyond 140 milligrams per deciliter, you have diabetes. If it lies between 120 to 140, then you have prediabetes. The simplest way to confirm if you have prediabetes is to undergo a blood test. The most accurate blood test is called the A1C test. This test determines the amount of sugar that is attached to the oxygen-carrying protein in your body, which is called hemoglobin. If prediabetes goes unchecked for a while, it'll result in full-blown diabetes. While you cannot confirm prediabetes except when you take a blood test, some giveaway signs could indicate that you have it, or you are on the verge of developing full-blown diabetes. If you can relate with any of these signs or symptoms, you shouldn't panic. What you need to do is see a doctor so you can do a blood test. Remember, the earlier you detect what's wrong, the easier it is that that issue will get treated. Number 7, you are putting on weight. You must have heard it said several times that belly fat is not healthy. That statement cannot be more honest. There are more reasons why you might put on some extra weight. Most times, excess weight gain is due to an unbalanced diet or lack of exercise. Whatever the cause may be, keep your diet and exercise in check so you don't gain weight in your mid-region. Here's why. Excess fat in your abdomen increases the likelihood that you'll become resistant to insulin. This is a major risk factor for diabetes. Your body converts the food you ingest into glucose, which is what your body cells utilize to create energy for their normal functions. However, the body cells don't take in glucose directly. Instead, they take it in with the help of insulin, which is created in your pancreas. So it becomes a problem when your body cells begin to resist the insulin in your body. This would mean that the cells won't be able to take in glucose, and the result effect is that you'll have less energy. This problem with insulin resistance can be induced by excess weight around your belly. The extra weight puts more pressure on the pancreas to produce insulin. What you need to do is simply get rid of the excess fat. There are 2 major ways to go about it, and they need to be done simultaneously: working out regularly and having a balanced diet. You should also increase your daily intake of vegetables. One way to do this is to adopt something called the plate method. Fill your plate halfway with vegetables. 1/4 of the plate should be filled with protein, and the other quarter should be filled with whole grain starch. Vegetables are super healthy, as they contain lots of vitamins and minerals. The best part is that you don't get to put on weight by eating vegetables, so you can have as much as you want. Number 6, changes in your skin. For the most part, pre-diabetes does not show any serious symptoms, and this is why many people have this condition without even knowing it. Sometimes, however, pre-diabetes shows up with some symptoms that are similar to those of diabetes. One of such symptoms is the discoloration of the skin. Any observed changes to the color of the skin could be a result of insulin resistance in the body. People who suffer this could have patches of skin in their armpit, on their back, or on the sides of the neck. There could also be signs of small skin growths in these areas. It's important that you keep a close watch on your skin and any symptoms that may show up. If you have any suspicions about any observed discoloration in these areas, endeavor to speak with a doctor who will conduct a blood test to rule out prediabetes. Number 5, a history of blood sugar problems. A medical history is always a good pointer to potential diseases that you should be wary of. This is why most times when you see a doctor at the hospital, your medical history is always a point of interest. If you've had blood sugar challenges in the past, then you'll want to be careful about your sugar intake so that you don't develop prediabetes or even diabetes. For instance, women who are diagnosed with gestational diabetes during pregnancy don't really go back to normal after pregnancy. This is why they need to be careful about what they eat and be watchful for any signs that just might be pointing to diabetes. There's also the matter of your family history and your ethnicity. African Americans, Alaskan Natives, American Indians, Asian Americans, Hispanic and Pacific Islander Americans are more likely to end up with prediabetes. Besides this, you should also find out if diabetes is common in your family tree. If this is the case, then you need to be more careful with what you eat and be more serious with physical exercise. Number 4, frequent urination. Do you find yourself urinating frequently? This is one of the commonest signs of diabetes, and it could also show up as a sign of prediabetes. When there's excess sugar in your blood, your body reacts by flushing it out through your urine. So if you notice that you're making more trips to the toilet, especially at night, then you might want to go get a blood test to rule out prediabetes or even diabetes. The same goes for you if you notice that the amount of urine you pass out is also increasing. Number 3, blurred vision. Rapid changes in sugar levels in your bloodstream could affect your vision. The lens of the eye is a flexible membrane that is held by the muscles. These muscles work to change the shape of the lens so that your eyes can focus. When sugar levels in the blood suddenly shoot up, the muscles of the eye have to work harder to make the eye focus. Although the lens does not get damaged, this results in blurred vision. The muscles struggle to bend the lens of the eye because they have not yet adapted to the increased blood sugar levels. This is an early warning sign that should never be ignored. Also, don't brush it off because it goes away. That doesn't mean the prediabetes is gone with. It just means that the muscles have adjusted to the increased blood sugar level. Number 2, constantly feeling hungry. Constant hunger is a telltale sign of diabetes, and it could also show up if you have prediabetes. As the blood sugar levels rise in your body develops insulin resistance. This forces the pancreas, the part of your body that produces insulin, to produce more insulin than necessary. The result of this is that your body gets saturated with insulin that it refuses to use, so you feel tired. But because insulin is meant to break down glucose, once it's produced, your brain wants to supply it with glucose to break down, which translates to you feeling hungry. But no matter how much food you eat, you're always going to feel hungry a little while later. So these cravings you feel not long after you've had a sizable meal could be an indication that you have prediabetes. Number 1, you are not sleeping well at night. Many people struggle with sleep for different reasons. For some, it could just be the stress of the office work messing up their sleep patterns, while for others, staying up for a couple of nights could have disrupted their sleep cycle. However, there's one thing we've got to tell you. Poor quality of sleep is unhealthy. For one, it increases the likelihood of gaining weight, which, as we've already mentioned, is a risk factor for prediabetes. Other sleep disorders like sleep apnea could also have adverse effects on the blood sugar levels in your body. Having very little shut-eye could set the foundation for prediabetes and possibly diabetes. It might sound trivial, but you should speak to a doctor if you're finding it difficult to sleep at night. Doing so might save you from developing diabetes in the long run. Do you have any of these symptoms, and are you concerned that you might have prediabetes? Don't get worked up. Here are 3 simple things that you must do right away. Firstly, take a blood test. There is only one way to know for sure if you have prediabetes, and that's by taking a proper test. To do this, you need to speak to a doctor first. The doctor will take an initial assessment, and if the diagnosis turns out to be positive for prediabetes, then you might be referred to by an endocrinologist. To ensure that you don't get a misdiagnosis, you can request for specific tests. One of such tests is the A1C test, which we've mentioned earlier. This test reveals the blood sugar levels of a patient over the previous 2 to 3 months. A blood glucose test is another quick test that reveals the blood sugar level of a patient at the point when the blood is drawn. There's also the C-peptide test, which reveals how effective your body is in making insulin. After diagnosis has been made and you now know what you're dealing with, you need to pay attention to regular exercise and you need to work on your diet. You should also add some resistance training to your workouts as they significantly increase insulin sensitivity. Working out has to be done in tandem with eating healthy. You should work out on limiting saturated fats, trans fats, salts, and sugar in your diet. Instead, focus on a diet that is rich in lean protein, healthy fats, whole grains, and fruits. For more videos, please click the like button, subscribe to the channel if you haven't already, and turn on the bell notifications so you never miss an upload. Thank you very much for watching SmartVille. We'll see you guys in the next video.